Okay, thank you very much. I think we may have overcome the technical problems. We're expecting Mr. Kirkos to arrive in a few minutes. He and his Socialist and Democrat MEPs have very kindly made this venue available to us, so we really need to thank him.
Maybe we should say that he was delayed to the airport because of the
Okay,
strike.
yeah, so apparently it's...
He went to Lille, and from Lille, that's the reason why he's late.
Okay, so he's had a difficult trip via Lille because of the difficulties at the airports with the industrial dispute. But I think we should probably get started. Have you got slides?
They are there.
Yeah, okay. So I'm Alan Glantz. I'm the project manager for Sprint, based at the London School of Economics. I was going to do some talking, but I think I'll cut that out for the moment because we need to get on with the programme and hand over to Anna Carla, who's going to make some introductory remarks. I'm very grateful to her for joining us, and very, very grateful to all the speakers who are going to follow this afternoon. So let me hand over straight away so we can get on with the programme to Anna Carla.
So good afternoon, everyone. My name is Anna Carla Pereira. I'm head of unit of modernization of social protection systems unit in DG Employment and Social Affairs in the European Commission. First, and before I go a little bit more into the topic, I would like to congratulate all the partners of Sprint for their collective endeavor. I had been looking at the recommendations of the project, and I think many of them will do resonate with me and with us in the preoccupations we have right now around long-term care. And of course, Sprint is financed via Horizon, as I understand, and we are always very happy to see research projects in the area of social sciences, because of course it's not always the projects that get more visibility out of Horizon, but we are always very, very happy to be part of these discussions. I wanted to give you a little bit an overview of the points that we look at when we talk about long-term care. I have some slides. Can you, is it up? Okay. So I will also have to look there, and there is a very strong light between me and the slides, so I hope I will not get blind by the time I finish this. Anyways, jokes aside, the reason why we in the Commission and DG Employment, but also with colleagues from RTD, we are interested on issues of long-term care, is of course that they are at the core of the rights that we believe citizens should have. And I just want to start my talk referring to the European Pillar of Social Rights, where access to long-term care has been clearly mentioned as one of the 20 rights that we should uphold in order to have a stronger social Europe. And we can, of course, know this by heart, the principle, everyone has the right to affordable long-term care services of good quality, in particular home care and community-based services. But knowing the principle by heart will not take us very far, because the entire point of the European Pillar of Social Rights is to establish a political commitment to bring us all together into a path that aims at ensuring that right. But of course, the principle per se does not grant legal rights. And so of course, projects like Sprint will help us having a clear view of where and how we can make sure that this principle is implemented. In our work, we look specifically at 4 areas. We look at access and equity, we look at sustainability, equality, and employment. And for us, these 4 challenges are essential for our collective capacity of implementing Principle 18. Let me start with access and equity. I don't know if you can see the slide. This is just actually rather fresh data from EU Silk, which is the survey on household income in Europe. This is the percentage of people above 65 that are at risk of poverty. This is 2017 data, so it has been published last week by Eurostat. And what you see, of course, is a very strong variation in the member states in terms of people at risk of poverty when they are above 65. But what it means, in any case, is that in some countries, like the Baltics, which are at the right side of the graph, is that a very big percentage of older population does not reach 60% of the median income. And that is, of course, a concern, because as you get older, and obviously long-term care services are not just for older people, but older people can be considered the prime client of long-term care services. And if you look at those figures, then you realize that if you don't have affordable services for elderly people, then many people will not be able to afford out of their own pocket the care and the service they are looking for. We do not have, let's say, robust data on to quantify the needs on long-term care, but Eurofound, if you can move the slide, Eurofound has a survey that they run on a regular basis on quality of life, and they had some questions in the last survey around long-term care. And one of the questions is how difficult it is for you to pay for professional home care services. And in this graph, what you see is on the blue bars, the blue parts, the amount of people who say that is very difficult to pay for home care services, and in the gray parts, those that say that is moderately difficult. So in any case, there is an understanding that paying for home care services is expensive in many countries of the EU. And of course, data like this, combined with the amount of people that are at risk of poverty, just gives us a signal of how difficult it must be for elderly people to have access to affordable services. And this, I say the signal, and I want to underline this, because one of the things that the Sprint project mentions is the lack of data. Mm-hmm. And indeed, this is one of the difficulties we have today, is the capacity of going beyond this general figures and trying to understand in granular terms what are the obstacles that people have, how much does it cost, who intervenes in the funding, and have this in a comparable manner across the EU, so that then we can also propose some initiatives. Nonetheless, for us, obviously, access to quality services is essential, and we do think that this is one of the areas that we have to look very closely at. if we can continue. The other aspect related to long-term care, and probably a more traditional one, relates to sustainability. And I say traditional because in the aging report that the Commission produces with the Economic Policy Committee, we have over the years projected the expenditure, the public expenditure on long-term care as a percentage of GDP. So there has been, let's say, a more constant analysis of the expenditure. And this graph shows you the last projections that the Commission has presented in the aging report, where in the blue bars you see the current expenditure of 2016, and the yellow bars add to that, and so the total would be the expenditure in 2060. And I think in all countries, the yellow bars are almost as the same size of the blue bars, so you can think that by 2060 we actually be doubling the expenditure on long-term care. And of course, this also brings an element of fiscal sustainability. We have obviously the strong objective of ensuring access to all, but this has a cost. And this cost is projected in some countries to massively increase. Now, I think these projections need to be taken with care, because what we are projecting here is current expenditure, and expenditure that is monetarized. So all the informal care that is currently being provided is not captured in these figures. So assuming we would know how much informal care costs to society, I would say these bars would go much higher in all the member states, and particularly in the states where the family network model is quite predominant. So aside the issue of access, obviously there is an issue of sustainability. And I would dare to say that in the last 15 years we have been worried around pensions, very much on similar grounds. And we have not yet truly looked at this little tsunami that is coming. And so I think it is almost inevitable that attention will be driven to these issues as these projections materialize. Then, of course, quality is also one of the areas where we need to concentrate, because there is an element of personal dignity, of course, but also as a way of ensuring that we focus strongly on prevention, and we try to minimize the cases where care is needed because prevention was not there. I think the bottom line around quality is, of course, that we cannot measure it. And so it is impossible for us today at European level to have a sense of where we are on this topic. We do not have EU-level standards, and we don't have quantification. So it is a discussion that has started some time ago in the context of the social OMC, open method of coordination with the member states. But I would say very little has been achieved in this area. And so this is one of the areas where we have to work the hardest in order to be able to have some informed insights on the problem. I should say that in 2010, the Social Protection Committee agreed on a quality framework for social services. This quality framework somehow went in oblivion for some years, but of course we have there an interesting source of inspiration to see how some of this could be applicable to long-term care specifically. So among the 4 elements that I wanted to mention today, quality is definitely one where our capacity of being informed today is still quite incipient. And finally, I wanted to share a little bit some thoughts on the employment angle. There are several dimensions to this issue, and let me start just by looking at the work-life balance perspective, because we all know that most carers, most informal carers are women. And of course, this has a big impact on the female participation in the labor market. Here in this graph, we just show you the share of female population that is inactive due to caring reasons. Now, we are not capable of disentangling whether these caring responsibilities relate to children or to, let's say, other relatives who need support. So today, this is an amalgamation of those 2 factors. But you do see that the figures are quite important in this respect. This work-life balance dimension is, of course, a very important one, and we have given an expression of our commitment to address this issue in the proposal, in the Commission proposal for a directive on work-life balance, where we proposed to have for the first time a carer's leave at European level. The Commission proposal was to have 5 days of leave. The directive is currently in trilogue, also with the Parliament, and the general approach that was agreed in Council, so the mandate the Council had to negotiate with the Parliament, did not include a specific number of days for care leave. So it just mentioned the need to have a carer's leave, but not the amount of days. So even if you think 5 days is not a lot when you have someone to take care of, you can see that even that in negotiations has been difficult to agree, is being difficult. The other aspect that we need to refer, of course, related to employment challenge, relates to skilling and reskilling. We see that more and more there's a carers are becoming more professionalization. Sorry, I was looking for the accent, the word. And we do see that many people who have caring responsibilities on an informal basis are becoming becoming formal carers. But of course, this requires an important effort in terms of skilling and reskilling to ensure that quality standards are met. Normally national quality standards. And so for us, this is one of the areas that we'll certainly look at also, for example, when we will be discussing the next operational programs of the European Social Fund Plus, to make sure that countries who wish to support training of carers through ESF, they can do so, and we can establish that as a priority. And finally, there is also an issue of working conditions. A lot of carers are in jobs that are badly paid, in low pay. They have temporary or part-time contracts. And of course, this also has an effect first on the retention of people in the sector, but also on the capacity of reskilling and continuing growing in terms of professionalization of the services. So many elements around this employment angle. Now, I think what is most striking for us at European level is that long-term care is a rather complex and diverse area. When we look at across the member states, the way they finance the systems, the equilibrium between informal and formal care, the way formal care is organized is so diverse that you certainly cannot say we have one solution at European level that fits all 28 models. So it is very much on an approach of learning from each other and hopefully getting to some common ground of how we can monitor this field, that we will be able to come up with something in the future. Can we just move to the last slide? So we are currently busy in addressing those two shortcomings. First, to try to have a common understanding of long-term care across the member states and working with the member states to have comparable data. We are, in the context of the Social Protection Committee, discussing possible indicators that can be used for policy monitoring, and this is the first step for us then to be able to bring the subject in a more forceful manner in the policy dialogue we have with them. Just my final slide to say that aside this monitoring and collection of data effort that we want to, or we are having right now with the member states, we do think that is important to promote activities of actors out there who are looking into this topic and allow us to be inspired by their activities. In the Easy Progress program of 2019, we will include a call on social innovation on long-term care. The total budget foreseen is 10 million. You will see that the call will be launched hopefully a bit before spring next year, so that we are able to select the projects still next year. So the amounts will be slightly different from the magnitude that the Sprint project had through Horizon, but we hope that through this call we can support further ideas that might spring out of Sprint. And certainly I encourage you to be attentive and look at the calls when they will be out. And I'm stop here and I'll be happy to exchange at any point.
Well, thank you very much, Anna-Carla. That was a really yes, thank you very much for setting the scene there. Many of those themes resonate with the work of Sprint about the need for data on delivery and outcomes of care, issues about measuring quality of care, the whole question of the balance of participation in the labour market and family responsibilities for care and so on. These are all key issues that we've been dealing with. Mr. Kyrikos may want to say a few words.
Just a few. We have prepared with my office an interesting speech, but we are late. And when we first heard about this event, we said, oh, come on, we have such important issues. I'm in the Libe committee. We have refugees drowning in the sea, refugees living in awful camps. In the transport committee, we have drivers working for 4 weeks continuously or 3 months continuously living in their trucks. So what should I? Yes. And then by reading into the problem, you get scared. And the more you read, the more scared you become. And then you start thinking that, wait a minute, the new labor models that appear, as the one I explained to you about the truck drivers, is one of the problems that we face, how we will fund these LPCs. And the other one, people coming from abroad, maybe if they come organized, maybe they are the solution to this situation that we face. And if, for example, in Greece, we have 50,000 less kids than we need to stay the same number. We have 50,000 more deaths. So imagine where my country, 10 million, is going to be in some years. So everything is connected, and these scary issues suddenly find replies. And the most important is that you will give today some indications what can be done, how these services can be funded, or how this model can be alive in the 20, 30 years in front of us. And it is more scarier because it's like the famous 2 degrees Celsius. If we don't do it today, there will be a point in the future where we won't be able to do it anymore. So you have to do it right now. So I'm very thankful for you being here, all of you, and I'm very interested in listening to your proposals. Thank you very much again for this initiative.
Thank you very much, and thank you for making this venue available to us. We really appreciate that. We are behind in the programme. I just wanted to say a few words to outline Sprint, but I'm going to try to cut those down as much as possible. So I'm Alan Glunt's project manager for Sprint. I just wanted to mention that Sprint is a collaboration across 11 countries with 12 institutions participating and acknowledged on that one. Can we have the next? I'm not going to go into the details of this now. You'll hear a lot this afternoon from Sprint colleagues who will outline the main findings of Sprint. The point initially was, as we said, stated in our application to the European Commission, which has funded the project, that the aim of Sprint is to give meaning to the concept of social investment in the context of long-term care. And as Anna Carla has indicated, this still remains relevant, although we're some years beyond the original social investment package. This still remains relevant in the context of the European Pillar of Social Rights. And you know, it's important that I think we make progress with discussing the findings of Sprint, but this event is intended to help disseminate the findings of Sprint, but also to provide a platform for other experts and stakeholders to discuss the key issues, as Mr. Kirkos has outlined, that we face in dealing with the challenge of demographic ageing and so on. So I will skip over these elements of Sprint and let my colleagues speak for themselves. We'll hear the policy recommendations from Sprint towards the end of the programme. If you could just put the last slide up, I just wanted to draw your attention to the Sprint website, where you can access some of the material that's been produced through the project, various book chapters, articles, deliverables, policy briefs, presentations, and so on. So this is an opportunity for you to learn more about what has been produced through Sprint when you've heard some of the presentations today. I think we'd better get on with it. I don't know whether we've got Bart here. Oh, you're here there. Thank you, Bart. I'm going to hand straight over to Bart to continue the programme. We'll just, because of it was already very tightly scheduled, but now it's even more tightly scheduled, and I'm going to have to be a bit brutal with people when they talk, so I may be quite rude and cut people off after they've said 2 sentences, but so be pleased, those who are going to speak this afternoon, please be as concise as possible.
I'll have to sit there because I can't read my slides from here.
Oh, okay.
Is that fine?
That's fine.
Okay.
Yeah, me too.
They can't come to these monitors here. The slides can't come to move along.
So the next session should
Okay. apologies for the technical problems. Okay, we'll let these slides be sorted out. Let's start with Virginia. Do you want to introduce yourself?
Sure. Hello, everyone. I'm one of the team members from Sprint. And it's a challenge and honor to me to start with very initial things that we started within the Sprint. So the challenge was to define what do we call social investment in long-term care. So my presentation is it's a joint collaboration of several colleagues, and I'm only one of the speakers, and together with me, this presentation was prepared by Alexandra Lopez from Porto University and by Hans Reinhardt from Fulda University. Where is Hans? Okay. So I will briefly present the concept of social investment within LTC domain and its dimensions, then legal aspects, and briefly will introduce main outcomes of our interactions in consultations with stakeholders concerning social investment concept. So we started, when we looked at different definitions that were used in relation to social investment, we couldn't find anything in relation to long-term care. So we had to define from very beginning what do we call social investment in long-term care from, when we started our internal conversation among the colleagues. So finally we decided that we would consider social investment as welfare expenditure that relates to equitable access to care and meeting of needs of aging population and improving quality of life and quality of care and quality of life. Together at the same time, increasing capacities to participate in society and economy and promote sustainable and efficient resource allocation. So it's very complicated, but to make it more clear. So mostly it is related to several domains. So first domain is about potential impact of provision of care services, enabling those potential carers and increasing need of especially informal carers to participate on labor market. And as Mrs. Pereira was presenting, this is mostly related with female participation on labor market. The second dimension is about independence living possibility of those elderly and postponing as long as possible their institutionalization. As in most of countries, as we realize, this is only alternative for quite a few of elderly people. Next aspect that we were thinking it would be worthwhile to look, it's about equity problems in access to long-term care, because we realize that there is broad diversity among regions, among countries, so it's more about equity and efficiency also in use of public resources. So it's social investment about well-being on both sides, for receiving care and for those who have caring responsibilities. And another impact of those other externalities that are related with LTC. So starting with that initial definition and potential dimensions of social investment, then we looked at legal aspects. How does it look like among European countries? So what we found that there is no individual right to LTC, but LTC is included as social pillar. That's why all member states are should provide citizens with more adequate long-term care. And looking again at variety of provisions among European countries, we realize that it's even difficult to have more systematic approach because such variety in scope of application, in type of an amount of benefits, organizational aspects, involvement of different stakeholders, it's very difficult to categorize. So when we defined social investment, when we looked at the legal situation within long-term care among European countries, then we decided that it's very important to talk to stakeholders from very beginning, because very often we hear that there is no common language among stakeholders and academicians. Before digging deeper into academic matters, we realized that it's very necessary to talk, if we have common perception, what is successful long-term care, what are the success factors, and if the term of social investment is known to stakeholders. Within a sprint study, in quite initial stage of the project, we had consultations with stakeholders about their perceptions of success within LTC, success factors, and knowledge and understanding of social investment. We performed a qualitative study, and the study was done in 8 countries, and we had 62 participants. And what do we find? We found out that in spite of very diverse variety among countries that were researched, perception what is success, it's quite similar. And success on national, institutional, and individual levels. All stakeholders were talking about consistency of national policy. They were talking about necessity to integrate social and healthcare systems, especially when responsibilities are divided between the 2 sectors. Talking about institutional success stories, a lot of stakeholders provided a lot of examples, and what was surprisingly to find out that not private institutions most often were mentioned as success stories. Those were mostly either non-governmental initiatives or public sector institutions. And talking about individual level, most of the stakeholders were talking about necessity to enable elderly people to live as long as possible at home without being institutionalized. Then when we asked stakeholders how do they see what are the most necessary criteria to have those success stories, again, stakeholders were identifying variety of different aspects on different levels. So first of all, they were mentioning that in quite a few countries, there is inconsistency in national long-term care policies, especially when different aspects of long-term care policies are divided between health sector and social sector. They were talking about adequate supply and availability of services. And again, regional differences, marketization, equity problems were mentioned as very important in avoiding those problematic issues within provision of long-term care. And of course, when going to individual level, most of the stakeholders were saying how important is that personalized approach. And different dimensions of that personal approach, I'm not going to go in details. I cannot read even from here. So next stage that we were talking to stakeholders and trying to find out is about concept of social investment. So when we asked our stakeholders in different countries, from representing very different welfare traditions, representing very different resourcing patterns in providing of long-term care, most of stakeholders were puzzled. They didn't know what we are talking about to them. when our project definition was provided and explained, a lot of those moments that, yes, we know what you are talking about, and a lot of examples were provided that could be related to social investment within a long-term care domain. So the conclusion from this study was that, yes, social investment as a concept is not known, but phenomena is very much recognized by a lot of stakeholders within long-term care. Also, going deeper into discussion with the stakeholders on social investment concept, most of stakeholders were saying that it's possible to evaluate impact of social investment, but the concern was that it should not become only monetary expression of evaluation. Suggestions were made in different focus groups or in different individual interviews that we had among different countries. Effectiveness criteria was mentioned. And again, effectiveness could be measured by improved functional capacity of those receiving care or improved quality of independent living. Also, another aspect that was suggested, it could be cost and benefit analysis of preventative and healthcare promotion, different programs that could be integrated within this approach of social investment. So those are the main insights that we received from stakeholders. And to conclude, we realized that in spite of broad variety, in spite of very different patterns in resourcing, perception what is success in long-term care doesn't vary too much in member states. Most of stakeholders agree that there are some criteria that are relevant in all the countries that we had interviews and focus groups. And again, that phenomenon of social investment is not something that is alien to the stakeholders. The concept is not known because probably most of stakeholders are not talking in those academic terms, but phenomena is recognizable and is relevant. So, thank you.
Thank you very much. I'm sorry if you felt you had to rush through that. You've got what? Yeah. Okay. So, going to move on quickly. In your program, I think it probably still says Ilaria Madama, but we have Claudia Zili to present in her place.
Can you hear me? Yes, now you can hear me. I just would like to ask you, do I have 20 minutes? Because I saw that...
If you speak as quickly as you possibly can and leave out any elements that may not be crucial.
Okay, perfect. Good evening. Thank you very much for this invitation. First of all, I would like to say that my colleague, Professor Ilaria Madama, was regret to not be able to be here, but I will try to represent her as better as possible. So, I will introduce the project InnovaCare. It is a project financed by Cariplo Foundation from the region of Lombardy in Italy, and it's developed by the University of Milan together with the San Raffaele University, Università Vita Salute San Raffaele, also from Milan. This project is a 2-year project that actually started only in April of this year. Sorry, can you check the presentation? Otherwise, I cannot follow. Thank you very much. And we'll conclude in March 2020. So basically, we had started to work some months ago. I won't take so much time to tell you why do study long-term care, because I think that you already work for a long time on it. So I will completely focus on the project. And the outline is this. I will tell you about What is InnovaCare? What have we done, our first step for the literature review, studying the state of the art of long-term care social innovation. And I will try to talk to you a bit about the Italian case. Why are we focusing on the Italian case from a comparative perspective, and a little bit of what will be developed during the next months as part of our empirical research. So if you want to go to the next slide, please. Ooh. It's difficult to read from here, but I will try my best. So what is it about our project? As I say, we focus on first of all, on the way that social innovation in long-term care can be defined. You were speaking before about the difficulty to define social investment. Well, you also know that defining social innovation actually it's very broad. So we depart from this, and after that we are trying to understand better what kind of policies have been specifically elaborated on this area of social innovation on long-term care, and what has been considered to be appropriate, effective, and until what extent this actually considers and satisfies also the needs, the expectations, and the difficulties of all the stakeholders that are involved. And with this, I mean specifically to this concept that we are using very much, that is the triangle of care, and we refer specifically to caregivers or care workers, mainly foreign workers, care managers, that are the families that are usually the ones living with the care necessities of the elderly, and the care receivers, that sometimes are the ones that actually need to be the most to be taken into consideration, and for health issues or for other considerations are the ones that are not considered. So we depart from this. We have we depart from two approaches, which is the positive approach, what has been done, what has been effective, and the normative approach or concern, what should be done, and what can we do to make these two concerns to find each other. If you can move, please. Our main approach, what are we trying to bring with this specific project? First of all, we want to apply interdisciplinary scientific knowledge at the service of political and social innovation in this specific sector. We depart also from speaking a lot with our stakeholders at the territorial level. Of course, we focus on the Lombardy region, the different provinces of the Lombardy region, and trying to make a comparison with other European projects that have been already developed. But I think one of the most important things is that since the very beginning of the project, as you mentioned also, that sometimes the stakeholders don't know what are we talking about, we really tried, and I can tell you that we had our first presentation, we tried to involve them very much since the very beginning. So I think this will be a positive element of our project. So we have, as I already told you, we are two main institutions, the University of Milan, Università degli Studi di Milano, Università Vita San Raffaele, but we have three research units. In the University of Milan, we have mainly the, let's say, the political science unit that focuses on social innovation and the welfare state, and will be the one that will analyze in depth the projects that have been elaborated and that you also have studied before. The second research unit, which is the one in which I mainly work, focus on the employment part of the phenomenon. And so we try to understand better the link between social innovation, long-term care, and international migrants, and especially female international migrants. For example, in the case of Italy, there is from all the regular domestic workers, around the 70–75% of them are foreign migrants. So we focus on analyzing this link very much, trying to also interview foreign workers. And the third research unit focus more on the philosophical and normative side of the phenomenon. So the University Salute Vita San Raffaele will focus mainly on understanding from a philosophical, ethical point of view, the concept of active aging, the concept of autonomy, dependency, and to understand very much, as I said before, the perspective, especially of the elderly. So these are the 3 research units. If you want to, please go to the... yes.
Can you see that?
Yeah, sure, I will try. I'm not over 65, but I start to have problems reading so far. So, as I already say, we try to understand what has been done and what should be done. And we especially want to focus also on the importance of the context in which we are studying this. Because, first of all, we spoke about the stakeholders, but as you already know, stakeholders change for every single context. The kind of actors that are involved, the relations between these actors. So we really want to address the challenge to explore how different local and national conditions may impact on the emergence, growth, and sustainability of social innovative products and process in long-term care. Can you please go to, okay, these, I can tell you that I cannot read it, but so, yes, basically here we are focusing on some of the elements of social innovation that that are the drivers on the one hand. What is promoting the implementation of social innovative initiatives on this sector, and what are the main difficulties or barriers? But of course, you can think in so many areas. So we focus, for example, on the legislation, on the kind of actors that are involved, on the sorry, but I need to just, on the existing forms of financing, especially when we speak about the interaction between the public and the private and the different forms that can exist, and on the existence of research network and other kind of foundations that work on this topic. So these are some of the main drivers, whereas the barriers, we have already identified some of them, such as a very strong division between the private and the public funds that work in this area, the lack of funds, especially from the public side, the lack of communication between the different stakeholders, and the lack actually of knowledge of existing services, because sometimes we may think that there is nothing innovative, but during these first months we have realized that there are several initiatives that actually are maybe not like cataloged as social innovation, but still they are. So if you can go to the next slide first. Here, you know them better than me, I think, and these are some of the projects, especially one of my colleagues that works in the Social Innovation and Welfare State Unit. he realized this analysis of all the projects, European projects that have been already developed. And of course, you are also there, your research network. So I think that we are learning also from your website about, and what we have done, just like trying to summarize all these first initiatives, is the focus on active aging, on prevention, that was already mentioned, on the multi-actor approach, all the stakeholders that may be involved, and on the need to actually define something as socially innovative when it's empowering in an individual and also let's say the society, the collective group around the person, and the use of the transversal use of ICT as such of the commonalities of these projects. So, thank you very much. So speaking about the Italian case, the particularities of the Italian case start from studying, recognizing, and analyzing the Italian case as a family-based care regime. And if you can show just the next slide here, you will see it much better than me from here, of course. But there is this, the way that we, in analytical terms, let's say, we categorize the existing welfare states in the countries, right? And in this case, we see that Italy, together with other southern European countries, are mostly categorized as traditional or family-based welfare states. What does that mean? That mostly is the family that actually takes care of the care needs of the elderly, not only, but in particular of the elderly. And usually this is done subsidized by money transfers from the public sector, but actually with such strict kind of controls that can be used to say whether this kind of care needs are being satisfied in the correct way, let's see. And actually, these money transfers are usually used to pay, formally or informally, foreign domestic workers. And this is, in the particular case of Italy, something that we have seen is this is because of two reasons. Maybe because of the lack of sufficient public, let's say, institutions that deal with the phenomena, but also because people, culturally speaking, do prefer to deal with the elderly at home. So it's not I think it is important to recognize that these kind of practices are done not only because of the lack of something, but also because actually people may do prefer to be close, to have the control, let's say, of who is taking care of their elderly. So, and this will be interesting, of course, to compare it with other countries, for example, the preference to deal with this kind of care needs at home or not. So, what does it mean? That in the case of Italy, we have a very polarized kind of system that goes from the completely private organization of care that is related to family to a completely institutionalized solution that means in recovery institutions that actually are not sufficient to deal with the care needs and in many cases, as I already said, may not be preferred by people. So we are trying to understand better how to create intermediate solutions between the family base and the full institution, and between, again, the private and the public. That's what we mean by intermediate solutions. And of course, we say, well, maybe in this process, the applicability of social innovation products and process may be very useful. So that's where our project depart. Can you go over? In this case, what we are trying to say, why to study Italy? Well, because this is one of the countries in Europe. If Europe has a population that is aging very fast, within Europe, in particular, Italy has a percentage of people over 65, but especially over 80, higher in comparison with other countries. If you go, you can also read it from there. Okay. So, something that was mentioned before is the public expenditure in long-term care. And actually, I'm glad to see that the graph that we have actually coincide with what was presented before. And it was worrying because actually nowadays, if you go forward, you will see, okay, there you have Italy. Nowadays, we are talking about 1.7 around, that's the number that actually was presented before, of expenditure in care, in long-term care. And actually, the graph that was presented before was speaking of 1.2. So actually, I said, well, yes, it seems that there will be older people, and the available funds may be not actually available. So this, I just have the number that there is actually invested nowadays. And what we actually see from here is that the public expenditure is not actually quite low in comparison with other countries. Is higher than the EU average. And actually, if I see it, is the 6th country in the region that is actually investing in public expenditure in long-term care. So what is happening, let's say, with all this money, let's say, how it is invested? And actually, this is, if you go to the next slide, please, this is actually one of the particularities in Italy, because as you say, it's not that is invested much less, but is distributed in a very different way in comparison with other countries that maybe invest the money in, let's say, in institutions that fully deal with the elderly, that are actually organized and managed by the public institution. Whereas in Italy, the money is mostly, you see it in the gray color, is mostly invested in these financial transfers that are actually done directly to the families to be the care managers, let's say, the ones that deal with care needs. Yes. Yes, I'm very close. So I will just mention two very particular characteristics. As I said, polarization between family-based, let's say, assistance and full institution. This is one thing. And the other very particular characteristic is fragmentation. Oh, sorry. Fragmentation. Why? Because in the country, if you go to the next slide, please. In the country, you will find actually very different realities. You see that when we make some cross-national comparisons, sometimes we forget that within countries there are so many differences. And the Italian case is particular in this sense because, of course, you may already find so many differences between the north and the south. So I will say, yes, please. Finally, these are some examples of social innovation initiatives that already exist in Italy in different regions, again. And finally, I will just very fast speak about the project. Can I have 3 minutes? Two. Okay. Then I will just tell you that this will be a mostly qualitative analysis that will include documentary analysis and semi-structured interviews with, as I say, the 3 members of the triangle of care: caregivers, care workers, and caregivers or care workers, care managers, and care receivers that are the elderly. And if you please go to the to the next one. Well, the stakeholders, as I just said, they have been involved since the very beginning, and they include not only, of course, the universities, but they include the municipalities. The municipality of Milan was present in our first seminar. The region of Lombardy, different areas of the region. There are also involved trade unions, associations that deal with care, and this variety of stakeholders and the involvement from the very beginning has been something very positive. Finally, we go actually to the very final. Here, I would like to leave you this because this will be your first dissemination channel. So if you want to follow what we'll be doing, you can follow Second Welfare. And hopefully we can learn from your project and you can still find something new from what we will develop during the next year. And the very final, this is not only my email, but also the email of the project and where you can contact us in case of comments, critics, of course, and any kind of suggestions to improve our work. Thank you very much for your attention.
Thank you, Claudia, and apologies again for you rushing through these things.
No, don't worry.
We were going to schedule a 10-minute coffee break. I'm going to have to ask you to take 2 minutes if you can, if you need to take some coffee before the presentation from our European Social Observatory colleagues. So if you want to grab some coffee, nobody's moving. Oh, okay. There's always one. Go. No, I'm okay. No, I've got water. I'm okay. So please make it quick. Make it quick and get your coffee injection. And come back to the seats. Thank you, Claudia. No, I'm so sorry.
I'm so sorry as well but I hope it was clear and it was complete because
It's interesting.
Yes, it is. Thank you.
So apologies once again for the compressed nature of the afternoon. I know everyone will help by trying to be as concise as possible and eliminate any material that might have been interesting if they'd had longer, but we'll have to cut. So we're going to continue with presentation from Bart van Herk, Director of the European Social Observatory, and Slavina Spasova, who has been the lead author of a recent ESPN publication on long-term care. So I'm going to hand over to my colleagues on the left, so off we go.
Yes, thank you very much, Alan, and thanks very much, everybody, for accepting these harsh working conditions. Skipping a coffee break is a very dangerous thing to do, but okay, we all had our quick cup, so thanks for staying with us. Many thanks also to the Sprint project partners for inviting us here today to add our small edifice, stone to the edifice. We'll build on what Anna Carla and Virginia have said, and also on the Italian case study. We've been asked to look at the nexus between social investment and long-term care. Of course, we'll say something, and I'll be controlling my slides from here, and then the colleagues over there apparently will follow or something like that. I don't know how that works, but you will figure it out. So we'll talk about social investment as an EU social policy paradigm. I'll explain that's how it was intended, but it really worked out that way. And then Slavina, who indeed was the lead author of our report on long-term care, will discuss national challenges in national systems, look into national reforms and ongoing policy debate, and then we'll end up with some EU level and national policy recommendations. So that's what we want to do. So I'll start with social investment as an EU social policy paradigm. And of course, we have to start with the good old social investment package. I don't have to explain to anyone here what that is, even though we don't see a lot of it anymore. We know that it was launched in 2013. What maybe we don't all agree on to begin with. Let's see if we need to discuss this. In our view, this social investment package was really launched in 2013 by the then Commissioner Laszlo Andor, who was still a very active proponent, of course, of this old idea. And it was launched not just as an idea, but with the ambition to be the new EU social policy framework. It was meant to be a new policy infrastructure, at least that's how we read it, that would be helpful to manage the various elements of public policy at the EU level, from identifying problems over agenda setting to implementation. So very ambitious to begin with. I think this ambition was reflected to some extent in this 2013 Commission staff working document, which of course you've all been using and citing, and which we've already heard about, namely the long-term care in aging societies, challenges and policy options working staff documents, which of course was part of the social investment package, favored social investment approach to social protection, which decreases the need for long-term care, focuses a lot, as we know, on prevention, on rehabilitation, on productivity and capacity gains for innovation, but also, of course, on quality assurance. And it calls for developing new ways of closing the gap between long-term care needs and provisions. And so there was, I would say, quite ambitious document at the time. 2013 is quite a few years ago. And I would say a quite smart framing of the nexus between social investment on the one hand and long-term care on the other. Because why smart? Well, because of course the link, for example, between investing in children, leave scheme for parents, and these kind of topics and social investment is quite obvious, I would say, and it was quite easy for the Commission in a way, but also for other international organizations like the OECDs to even build a business case for this kind of social investment. We remember that the subtitle of the SIP was Growth and Cohesion, right? For long-term care, of course, this is far less obvious. This was far less obvious because they are, of course, aimed at long-term care is aimed at the frail and the elderly, their well-being, and it is, let's be honest, quite a far stretch from the pure idea of social investment, and the business case for this is not so easy. But, as I said, I think the Commission made quite a good attempt at framing this nexus. By indeed referring to the elements that I've already referred to just before, and linked social investment indeed to long-term care policies by pointing to prevention, rehabilitations, etc. If you want to know more about that, we wrote in 2015, the very first report that we wrote for this European Social Policy Network, that I will come back to in a moment, was about social investment. Those who haven't seen that yet, it's still time to go and pick it up. It's still on the Commission website. Now, to wrap up my part of the talk, I think it's quite clear that social investment never really worked as an EU policy framework. Unfortunately, I dare add, it was embraced especially by the academic community, and I'm happy that, in this kind of circle, social investment is still very much alive. Also by, I should add here, Virginia, having listened to you, EU social stakeholders who have been working very actively and even proactively with the concept of social investment, but unfortunately it hasn't been picked up by national policymakers, nor indeed by national stakeholder organizations. So I will have to amend my slide. Thank you, Virginia. I think part of the explanation is that, well, it was launched at the time by DG Employment of the Commission, by a particular commissioner. I don't think it was carried by the Commission as a whole. I don't think President Barroso was a very big proponent of social investment, and quite clearly, I would say, but we have the Commission here present to contradict me if needs be. I think the new Juncker Commission, in its first years, didn't really use the concept for several years. Now, does that mean that social investment is off the agenda? No, it's not, of course. So it's not a black and white story. It didn't work as a policy paradigm or a policy framework, nor has it disappeared from the agenda, not only because academics and EU stakeholders keep on talking about it, but also indeed, and I have to acknowledge that, in the multi-annual financial framework or the proposal for the next period, in the proposed European Social Fund Plus or ESF Plus, indirectly in some of the country-specific recommendations, as well as different years of the annual growth survey, so the key instruments of the European semester, there are indeed direct or indirect references to social investment. So it's still out there, not as a policy paradigm or a policy framework for EU social policies, but still as an operational concept. So I think there is some gray between the black and white. Most importantly, it's there under the radar, I would say, in the context of the European Pillar of Social Rights, which is, of course, now the new EU social policy framework. It has, in a way, absorbed the social investment package. It's more than the SIP, but it has absorbed it, I would say, including with regard to long-term care. I don't have to repeat this. Anna Carla already referred to Principle 18 on long-term care. So this is one of these instances, Alan, where I will cut it short. Now, the question with regard to long-term care and discussion it entails about social investment, or one of the questions is how to reconcile financial sustainability challenge with challenges relating to access to adequacy, to employment, and to quality. And precisely this question was at the core of a report that we produced, it seems so long ago, but actually it's not so long ago, on challenges in long-term care in Europe in the context of the European Social Policy Network, which is a Commission-funded research network. So we provided it, or we did this analysis drawing on, as you just asked me during the coffee break, Virginia, what is your material? Well, we are so lucky to have each time 35 national country reports produced by expert teams, academic and other, in the 28 member states and some other non-EU countries. And what we do then at the European Social Observatory, but also at LISER and Applica, is then write synthesis of these national report. And the one that Slavina Spasova, who was the lead researcher on that report, will now zoom into, was of course the one on long-term care. So please, Slavina, the floor is yours. And the colleagues are still following over there, so everything's fine.
Good afternoon, and thank you for the invitation. I will continue with the four main challenges which were identified in our report. I will try not to repeat what Anna Carla already said before, but we'll try to provide some more examples and try to be not too long. So the first challenge is the challenge of access and adequacy. The second one linked to the quality of long-term care. The third one, the employment challenge, and finally the financial sustainability challenge. As for the challenges of access and adequacy, access seems to be hindered in many of these 35 countries by an interinstitutional and territorial fragmentation. Many ESPN experts pointed to the not always clear division of responsibilities between the healthcare and the social sectors, and also not so clear division in, between territorial entities linked to provision of long-term care. The second challenge related to access is deinstitutionalization. When we started working on the report, the Nordic members of the network, they said, well, for us it's quite clear, we have a problem of deinstitutionalization in our countries. And what we could see is, it's true, there has been a prioritization of home-based care at national level and also in EU discourse, but what is quite clear of these 35 reports is that there are two main trends. First of all, indeed, Nordic countries and some continental countries with long tradition of residential care have been reducing their residential places over the 10 past years, and even before for some Nordic countries, while there is another tendency in southern and central and eastern European countries which do not have such a tradition of residential care, and we see here a tendency towards a creation of residential places. And let's have a look at this figure. Let's have a look, for instance, on Sweden. It's the tendency of reducing residential places is quite clear, while just next to it, Spain, we could see the opposite tendency. Again, an overview. So in the Nordic countries, the number of residential beds for persons 65 plus has been steadily diminishing since 2005 in some of these countries, and it became a common trend after 2010 in all of these countries. But still, these countries have among the highest percentages of long-term care recipients in residential facilities. Moreover, in these countries, home care and community-based services are the most developed among the 35 countries under scrutiny. And we could see some good examples of social investment in rehabilitation. And here the Danish report is quite interesting if you'd like to have a look. It's on internet. As for continental Europe, the trend is less pronounced. There has been a slight decrease and then followed by a slight decrease. And here Luxembourg is an exception. The country doubled the number of beds since 2001. Again, in these countries, we found out that there is well-developed home-based and community-based services compared to, for instance, the Southern European countries and the Central and Eastern European countries. In the Southern European countries, we see a clear trend towards an increase in residential beds, so we can't talk about de-institutionalization in these countries. And at the same time, there is insufficient availability of home-based services. The situation in the Eastern European countries is similar, though it's less clear-cut. There has been a slight decrease in the number of residential beds in some countries, but it also depends on the sector, whether it's the health sector or the social sector. There has been a steady increase in the number of residential homes in Bulgaria and Romania, for example. The Romanian report in this sense is very interesting. It shows how especially private homes have been developing. And then in these countries there is a clear, we could clearly see that there is an underdevelopment of home-based services. We also concluded that the Central and Eastern European and the Southern countries are facing similar challenges. The demand is exceeding the supply of long-term care, and this is due to changes in family structure, increasing in the pensionable age, especially for women, and emigration. What about adequacy of long-term care? As Anna Carla already referred, there are no indicators. Only some countries have some indicators on how to measure the cost of long-term care. And so we asked the ESPN experts to provide some specific examples with administrative data. And here we could see that the German expert pointed to the decrease of the purchasing power of benefits in their country. And for instance, the private costs for long-term care amounted to 36% in the total expenditure on long-term care. In the Czech Republic, the monthly care allowance for heavy dependency is estimated to cover approximately 2.5 hours of care per day. We also tried to somehow measure the sufficiency and the affordability of long-term care through the indicator on private expenditure on long-term care, which is the highest in the UK, Ireland, for instance, and afterwards I will show you that these were also the countries which had important budget restrictions during the crisis period. Another feature related to affordability of long-term care, some ESPN experts, for instance, from Belgium, UK, Germany, they pointed to the marketization and the privatization of long-term care as an issue of affordability for long-term care recipients. And finally, a good news, let's say, there are also some examples of social investment to improve access and affordability. For instance, in Estonia, there is an interesting example of the use of the European Social Fund in order to improve access and especially to home long-term care services. The second main challenge, the challenge of quality, which Anna Carla addressed already, what we found regarding this challenge is that there has been a constant refinement of standards over the past 10 years. However, the quality of long-term care remains still a problematic issue in most of the EU countries. And here, requirements vary substantially according to the type of care, residential care or home care. Home care remains mostly unregulated, and according to the sectors, the social and the health care sectors, I mean, in some countries the health sector has clear and well-established standards in comparison with the social sector. The third challenge, which also Anna Carla already addressed, is the employment challenge. I won't go into details. Here I would like to refer of what my mentor in long-term care policies and work-life balance Denis Bouget calls the invisible social welfare scheme. Today in 2018 we see that long-term care is still a family obligation in most of the ESPN countries, fulfilled mostly by women and generally without any direct compensation. The reasons which were highlighted by the ESPN experts are the shortage of accessible formal long-term care facilities, the poor quality of long-term care in some countries, the non-affordability of long-term care, and also the traditional model of intergenerational and family relations, which is still well enshrined in especially Southern and Eastern European countries. And here, Anna Carla already showed you a graph on inactive people looking after dependent people. Here, and as she already pointed, there is no breakdown per age, so we don't know who cares for, how many people are caring for elderly, but we could suppose, because women in literature, women and men of the age group 50 to 64 are most likely to look after elderly than after children. And what we could see in this graph is that, unsurprisingly, we women look more after people, almost 6% compared to men, 1.4%. And here the UK and Ireland are topping the charts, while, as you could see, Nordic countries, for instance, Norway, Sweden, they have among the lowest values. And what we also found, unsurprisingly to all of you, there is a great variation in the support for the carer, in care leave, cash benefits, social insurance coverage, flexible working arrangements. In general, what we found is that there is a lack of adequacy of provisions according to the needs, and also there is a lack of awareness. Apparently, there is a low take-up in some countries, especially regarding care leaves. As for services of carers, they also vary widely, and what was pointed out by the ESPN experts is there are rarely services available for cares for the elderly. There are also here some good news. For instance, some countries have been implementing policies for investments in carers. For instance, Poland have implemented a benefit to support the labor market reintegration of carers using subsidized employment measures, and Portugal and France have been reforming their schemes, and they have been implementing various support measures for informal cares over the past 5 years. As for the last challenge, which has been discussed lengthy here, we know that public expenditure, depending on the projections, is projected to increase by 70% between 2016 and 2070. What we all know is that there is a great diversity in spending. In general, Nordic and continental countries are among the leaders in expenditure, while Central and Eastern European countries score the lowest values at around 0.3%. And in our report, you can find different examples, country-specific examples of how countries are trying to deal with this challenge of sustainability. But there are also some common challenges, and they are also similar to the challenges. They are linked to the challenges to access to long-term care. This is the fragmentation of care, lack of coordination between health and social entities, and the lack of clear financial strategies of the territorial entities responsible for long-term care, which leads to unpredictability of long-term care spending in many countries. Finally, what we found in terms of conclusions on reforms and debates, things are really moving. Long-term care provisions have been subject to several reforms in most of the 35 ESPN countries over the 10 past years. And here we try to group these reforms in some trends. There are three main trends. The first one is the readjustment of the long-term policy mix. As I already said, there is a clear move away from residential care towards home care and community care. There have been, in several countries, measures addressing the financial sustainability. And I already mentioned the importance of budgetary restrictions in some countries during the crisis period. But again, there are also some measures going to the direction of better access and affordability of provisions, including the improvement of the status of informal carers. For instance, increased long-term care funding in Estonia and Romania, improving eligibility conditions and benefit levels in some countries, tackling the above-mentioned interinstitutional and territorial long-term care fragmentation, and finally, recognizing and improving the status of informal carers. And here the Czech report is quite interesting to be read. And finally, I will finish with some policy recommendations. Based on these challenges, we provided a battery of recommendations. Here I choose only 4. Which are linked to the conference today. First of all, we believe that development of formal home care and community-based care should be priority in all countries, but there is a clear need for appropriate funding in order to ensure accessibility and affordability of provisions. We also believe that while prioritizing home care over residential care, countries should avoid policies which reduce the supply of residential institutions without providing sufficient home-based services. And this is what we see in some countries for the moment. As for informal carers, it's important to invest in carers. Stronger support should include improved social security rights for the informal carers, providing adequate training, upskilling and recognition of skills, and enhanced possibilities to remain in the labor market through flexible employment, part-time carers, awareness of the existing measures, etc. And we also provided some recommendations to the EU level. First of all, we believe that in implementing Principle 18 of the European Pillar of Social Rights, the EU should pay attention to all strands of long-term care and ensure a balanced approach between the home care, community care, and residential care. And this should reflect the different needs of dependent person. And finally, we saw in Estonia, for instance, we believe that the use of EU funding, notably the ESF Plus, should be promoted to develop home care, assist in the improvement of skills, and support the informal carers, and especially in countries with the least developed long-term care systems. Here you could find some of our publications on long-term care and work-life balance, and thank you for your attention, and me and Bart, we are available for questions and comments. Thank you very much.
Thank you. Thank you. A massive, fascinating material. This is where we're going to have to compress more time. What we're sacrificing at the moment is opportunity for questions. But if anyone wants to make a quick point or ask a quick question while people are assembling, we could take one. But otherwise, we probably need to move on. Okay. So. So he, Thank you very much. Sorry, bit of shuffling on the stage here and trying to get things timed appropriately. But so let's move on. I think Ismo, you're going to lead off.
Yes.
Okay. Please introduce yourself.
Yes. Thank you, Alan, and thanks for. Okay. Yeah. For giving me the opportunity to talk here. I'm really, I'm going to present results that we have obtained in the Sprint project, and I'm really a talking head here. So whatever I'm going to say is going to rely on the work that my colleagues in the Sprint project has produced, like Jose Luis Fernandez, Bent Greve, and Alexandra Lopez, and also Adam Richards, who's not here in the. So I will talk about tools for social investment in long-term care. And if we start from the message, central message of Sprint, social investment approach has considerable potential to enable decision makers to strengthen long-term care systems across the EU and thus help address the challenge of population aging. And of course the question is how can it be done? And in the Sprint project, we have developed various tools and methods that can be applied to achieve these goals. And my plan here is to give you an overview of those tools and also discuss some of the substantive issues that are involved with with the application of these tools. So I will start with the following kind of framework. So in long-term care sector, we need various kinds of inputs like labor, capital, and material, and those inputs are being combined in order to produce outputs like intervention services and policies. But basically, we are not interested on those outputs themselves, but we are more interested in the final outcomes like the well-being and health of old care recipients. We are also interested in labor market outcomes of informal carers, and we are also interested in sort of macro level objectives like efficiency and equity of the resource use in the long-term care systems. So we can measure the cost of investments by measuring the value of inputs that we are using in the long-term care. If we are able to measure also the monetary value of outcomes, then we can start comparing costs and benefits and come to the conclusions whether the monetary return of investment exceeds the cost of investments, and we can start answering the question whether these investments have been worthwhile. So there are various steps that are needed to implement the framework in long-term care. I think it's a good idea to start with the definition of social investment in long-term care. I will spend very few minutes on this because it already appeared in Virginia's talk. We need to identify relevant stakeholders and also define outcomes of long-term care for each stakeholder. We need to develop reliable ways of measuring monetary value of outcomes. This can be a challenging thing. I will talk about that a little bit more. And we also have to deal with causal questions about the causal relationship between outputs and outcomes. And finally, we have to put everything together and start comparing costs and outcomes of long-term care investments. So here is the definition of social investment that we have developed in the Sprint project. And I think it's a sort of novel thing that we have produced in this project. It didn't appear in the literature before the Sprint project. And I'm not going to read it because Virginia already read it. But the definition gives us some kind of idea of the sort of interventions or services that we are interested when we are looking at the social investment in long-term care. but I will go to outcomes of long-term care services and start discussing about that. And as already definition of social investment sort of suggests, we are taking a very broad view to outcomes of long-term care in the Sprint project, and we are considering several outcomes for various stakeholders in the project. For example, if you think about old long-term care recipients, the use of long-term care services may affect the health and well-being of the care recipients. This is sort of expected. But also there may be some impacts or effects on the family members of old long-term care recipients, and we might see well-being effects for the family members because these family members have altruistic concerns for the health and well-being of close relatives. Informal carers are of course important stakeholders in the long-term care field. So the provision of informal care may have an effect on earnings of informal carers. It might also affect the health and well-being of informal carers. Actually, we know that there's a lot of evidence on this in the literature, and there may be also a risk of low income and pensions associated with the provision of informal care. And then care providers. When I talk about care providers, it includes a lot of things. I'm referring to local authorities, public and private providers in this case. So the provision of provision of long-term care might have an impact on the use and costs of other health and social care services. So that when people are receiving informal care and people are using home care, we might see a reduction in the use of other formal health and social care services like institutional care and maybe even healthcare services. So there may be so-called substitution effects available. And of course, we can also think that the monetary return that private providers are receiving is one outcome that we should consider as an outcome of long-term care services. Then a few things about the monetary value of long-term care outcomes. This has been a topic that we discussed a lot in the project. We spent a lot of time discussing about it, analyzing this topic, and this is what we came up in the Sprint project. So when you think about the long-term care outcomes, some of the outcomes are more readily monetized than the others. If you think about earnings of informal carers, for example, that is directly measured in the monetary units. So we don't have to worry about that. That's already measured in money units. But when we talk about health and well-being outcomes, then those outcomes are more challenging outcomes. And they don't really have a universally accepted methods to monetize at the moment. There are methods in the literature, replacement and friction cost methods. These are the cost-based methods. Stated and revealed preference methods are also there in the literature, and there is, I think the latest method is the well-being valuation method. What we have done in the Sprint project is that we are following the principles of social return of investment, which is basically using these same methods to value outcomes, and we have shown the potential to monetize the long-term care outcomes through illustrative examples, but we also emphasize the stakeholder involvement in the valuation of outcomes, because we sort of acknowledge that there may be a lot of variability in the valuation of outcomes across the stakeholders, and this variability should be taken into account. And we sort of think that the stakeholder involvement is the way to do this. So this is what we have produced in the Sprint project. Then a few words about measuring and finding causal effects. So basically we have a lot of ways of approaching this topic. We can do primary research, we can run randomized control trials that are sort of seen as the sort of unbiased way of producing causal effects, but in the social care context they are often considered unethical because the service allocation is typically based on the needs of service users. We can also do observational study or apply observational methods, but then we are confronting the question of potential selection bias, which is caused by the confounding factors. And I think we have to spend a lot of time with dealing with this selection bias. We can also apply the methods of qualitative research, as has been described by Richards in one of the sprint deliverables. If there is a lot of evidence already in the literature, we can always do literature reviews, and that allows one to summarize the existing evidence. But the questions there are, of course, that we need to assess the quality of evidence. We can't be certain that the quality of evidence is always good. So that's one topic that we have to deal with. And the other one is that we have to ask whether the results generated in one country can be transferred to other countries. So if we have a lot of evidence from the United States, for example, on the effects of informal care, it's not necessarily the case that those results also apply in European countries. So this is one question that have to be dealt with. And then the comparison of costs and outcomes of long-term care. And what we have done in the Sprint project, we have developed a framework which we call impact map. It's really a framework and to bring together cost and outcomes and allow the comparison of cost and outcomes of long-term care services. And there are various steps that are needed to develop an impact map. We first have to answer the question, what is the need for long-term care? What sort of interventions are available to meet the need for long-term care? What evidence is available on the effectiveness of interventions? And we also have to measure the cost and outcomes of interventions. And then we need to start comparing benefits and costs. And of course, we have to deal with the question of how to monetize the outcomes of long-term care at this stage. And if we are able to do it, then we can start comparing cost and outcomes of different options available and find the sort of best available alternative or intervention available that can be where to invest the funding. With the Impact Map Toolkit, we have also produced a report that addresses the core issues related in understanding and developing an impact map. So basically, I'm coming to an end. I'm just showing our output. So here are the outputs that we have produced in the Sprint project. There's output on definition of social investment, definition of long-term care outcomes. We have 2 deliverables on principles and methods to value outcomes, and then there's an output on Impact Map Toolkit. In addition to these deliverables, we have also produced a practical tool that allows the comparison of costs and benefits of social investment in long-term care. And if you are interested in using that tool, it can be found from the Sprint website. Okay, so I think I'm done now.
Thank you very much, Isma. Thank you very much. We're speeding along. Ben is going to go.
Great. I didn't bring up my laptop.
This is Ben Jupp from.
I'm sure the presentation will come up and we'll just flick through it.
We're very long-sighted.
Yeah. As I said, I'm Ben Jupp. I've had an interesting 15 years or so in my career because for 7 years or so I was in the central government of UK where when we thought about investment, these were very much macro investment decisions on the allocation of state resources. And for the last 7 years, I've worked for a not-for-profit called Social Finance, which has been much more involved in investment into social enterprises and into projects, which is a different sort of paradigm of organizational and venture investment. And really the conclusion that I want to sort of start with and leave you to is that both paradigms are important when we think about investment into long-term care. And I'm going to illustrate that just with example of one project. We can go to the next slide after that, slide after that, one more slide. With an illustration of one project to seek to improve people's health and well-being, reduce their movement into residential care by helping address loneliness and isolation in one part of England, in Worcestershire. The next slide. This project was conceived as testing a community-based response to loneliness and isolation, which affects at least 1 in 10 older people in the UK. By linking them up with health services and social care, with an assessment which is made of their needs, very much person-centred in terms of their aspirations and interests, then links them up with a volunteer to help them develop reconnections, whether that's social activities, overcoming emotional challenges, and tying them into a more interdependent community. I'll go to the next slide. And the one after that, actually. I'm going to be brief on this. I just wanted to say a teeny bit about the process of the social return on investment analysis, which this was an example of. When we looked at this area around reducing loneliness and isolation, there was actually a relatively poor literature review on really assessing the economic impact of reducing loneliness and isolation. But there are some promising studies indicating the relationship between reducing people's loneliness and their reduced need for residential and healthcare. The broad conclusions of that analysis is that there is an impact of reconnecting people, both on terms of people's short-term resilience and therefore their likelihood of needing care in the short term, but also their long-term well-being and the development of the reduced likely development of dementia, coronary heart disease, and other conditions. And that gave us a broad framework. We then, moving to the next slide, and you don't need to see all of this, we then worked with our colleagues in the London School of Economics to refine that analysis, which broadly showed that on the economic basis, there was a slight positive case for investing in these sorts of preventative measures rather than into more traditional institutional care. I think that reinforces the find that these are not enormous economic gains in the way that investment in skills or early years would be, but it's an important framework to consider. We'll move to the next slide as well. I also think I'd reinforce the fact that in these areas, looking at outcomes is as important as just the economic benefits. And we used and continue to use a measure of looking at loneliness, which is well validated across the UK and other countries in a 4-point scale. But the really interesting thing about the project has not been the macroeconomic analysis, much as that is interesting. The real thing which is exposed is the enormous variability in the quality of delivery of similar types of projects by different providers. And in this organisation, we started off with 7 different, usually community-based providers of support and care. And what we found is that the approach which was taken, but also essentially the fundamental drive, effectiveness and productivity of different services varied enormously. And I suspect that is the case in many projects which span the boundaries between informal and formal care. And in that context, the allocation of resources between different organisations becomes really important. How does the social economy manage that allocation to providers? In the case of our project here, because it's one project with 7 providers, we were able to kind of quite quickly move resources around. We dropped 3 providers and we started to refocus on others and we improved their overall productivity. And so I think I would just, add to this conversation that alongside the macro analysis of social return on investment in long-term care, all countries need to think about what conditions they're putting in place to enable the allocation of resources to different providers within a social economy, the stimulation of quality and of innovation within that. Thank you.
Thanks very much. Can you do it quickly?
Yeah. So Alan has just reminded me to be very quick, and I'm going to be very quick because Alan can be very fierce if you don't comply with his orders. So is it, Dimitris, is it you that is, okay, so I'll wink at you every time. I want you to press the, so I'm José Luis Fernández. I'm based at the London School of Economics, and I'm going to talk about one of the work packages of the Sprint project, which asks the question, to what extent can social investment principles drive decisions from government, specifically about government, because of course social investment is not purely about government as a decision maker, but to what extent can social investment principles help governments decide whether to invest in social care or not, long-term care, social care. We use social care as a term in England. And thank you very much. Let's just... so I don't want, Alan thought I was trying to put you off by having an equation there. It's only one equation, and actually the aim is to illustrate that implicit in the social investment approach, there is a very simple calculation, which is that, and actually I think this applies to any investment, is that if you want to understand whether you want to invest or not to invest, you then need to compare what it is that you're going to get out of the investment, the benefits, and that's the sigma B, the benefits, but also you want to compare those benefits against what you're having to invest, the cost of the investment. Yeah? So it's very simple. We want to look at net benefit of interventions, and we want therefore to compare the benefits against the costs. Can you please click another and once more, and then keep it too far. Thank you. So I've highlighted just a couple of notions there which are important. One is it's net benefit, so it's therefore not benefit, is benefit relative to costs. That is a very important aspect, and we have to think about how this applies to long-term care. But also, I've highlighted the value of the benefits. If we want to compare benefits against costs, we're going to have an idea of how to compare them, yeah? Because benefits might be expressed in units which are very difficult to compare against costs. And that's something that we need to think about when trying to apply social investment approach in the long-term care sector. And finally, I've highlighted those sigmas because, as Ismo was explaining a second ago, it's not just one benefit, it's many benefits. And so we have to think about, and that's the strength of the social investment approach, I think, in long-term care, when applied to long-term care, is that it forces you to think about the full breadth of consequences of benefits that might be derived from investments. And therefore, from a government perspective, that makes complete sense. Thank you very much. Let's just... it's not finished yet. I was smiling already. I was hoping not that quick. So obviously doing this is going to face us with some technical problems. Actually, Ismo has covered some of them, and I don't want to spend any time in explaining them, but just I will mention very quickly. One is that there are many different consequences we want to bear in mind. There's the impact on the well-being of users, carers, but also the consequences on employment, etc. So we need to, understand the full breadth of those consequences. And then we need to bring them up together. We need to aggregate them. We need to see what the overall value of those benefits is. That's not an easy thing to do. And then, of course, we need to in order to do that, we need to show some sort of preference between them. And those preferences might vary, for example, and are likely to vary very significantly between countries. Yeah? How much do we value carers versus users versus, all those things will vary between countries. Of course, we need to bear in mind that these investments might have long-term effects. Yes, I should have... Can you hear me okay now? Yeah, sorry. And then finally, one that I think is very, very important because it means it has some very important implications in terms of the data that governments need to collect, which is whether we look at raw versus, or the importance of not looking at raw outcomes, but looking at the contribution of services. And I'm going to illustrate that with the next slide, which I won't talk in any detail because I would spend too much time. But this slide, is quite pretty, so I'll put it there. But the idea behind it is that quite often when you look at the consequences of social care, and you focus on raw outcomes such as the quality of life, or, for example, how long you can keep people in the community, help them live independently in the community, which is what this slide relates to, those outcomes, those raw outcomes, are going to be poorest, lowest for the people with the greatest needs. But that doesn't necessarily mean that it's not for those people that services are actually having the greatest contribution, achieving the greatest productivity, in a sense. And there's a lot of evidence that suggests that actually you need to really pick up the contribution of services to outcomes, not outcomes in their raw form, or you will misunderstand the consequence, what the system is achieving. Okay, I'll just leave it there because I don't have time to go into further detail, so click another few times until those things disappear. There'll be another one. Carry on. There we go. And so, okay, so we do need, so let's imagine that those technical problems are not so important, and that we can therefore have some measure of the benefits and some measures of the costs of bringing a new intervention in the long-term care system. We might be able to measure those, and therefore different things might happen. Click once, please, Dimitris. It might be that actually that intervention is leading to higher costs, worse outcomes. Well, we want to reject that for sure. That's easy. One more. It might be that actually reduces costs, improve outcomes. That's easy. We want to do a lot of those things. That's the good news sort of quadrant. So that's, the figure is just illustrating the sort of scenarios. On the horizontal axis, you've got differences in benefits, on the horizontal, differences in costs. Or, and click once more, please, thank you very much. Or it might be that actually what you're getting is a trade-off between costs and benefits. So you might be improving benefits, but it's costing more. Now, that's a tricky thing to do, or to be faced. A situation where government then needs to decide, do I or do I not? Please click one more. There we go. We're going to have to come up with some sort of willingness, measure of the willingness to pay, the societal willingness to pay for improvements in outcomes. Okay? And therefore, what we're saying is that in order to implement the social investment framework in terms of guiding decisions from government, you need that sort of idea about what government wants to pay. How much are we willing to pay for improvements in long-term care outcomes? Carry on. Just until you get rid of the slide, I don't have time to go into any further details. So we did look at, we did a review of evidence on the use of that approach internationally. No government has an indication of willingness to pay for long-term care outcomes. There isn't such a thing at the moment. In fact, there aren't agreed indicators of long-term care outcomes. There's some excellent work being developed. Partly I will say that because I need to declare an interest. I'm involved in a unit that is developing some of those indicators. But ASCOT is an excellent outcome indicator. ICECAP is an excellent outcome indicator. It is being recommended in certain places, but there's still no agreed outcome indicator for long-term care outcomes. And this is something that absolutely is required. But also, we then need to understand how much society is willing to pay for improvements in those indicators. And at the moment, we don't have an idea. We looked at related areas in the healthcare sector in particular. We did find, there's much more history of using this sort of approach. And there's in particular, how many of you do not know about the QALYs, so that I can skip the... Okay, everyone knows about QALYs. Excellent. Well, if you look at what the measures of social willingness to pay for QALY, you find that in England in particular, which is where this has been pushed, I think, to its extreme, there are indications which say that government decisions are based on a willingness to pay of £20,000 to £30,000 per QALY. That means that government will pay up to £20,000 to £30,000 per year in order to get a treatment that will improve somebody's well-being from zero, from death, to full health. Now, that's quite an achievement. I don't know many of those. So £30,000 in order to achieve a massive improvement in outcomes. Now, next slide, please. If you look at the care packages in social care, you will find that there are many which cost way more than £30,000 per year. Any residential care, well, any no, but most in England will cost more than that. So, that's challenging, isn't it? So, to what extent can we apply the same sort of thresholds in social care? Or to what extent do we need to go beyond cost effectiveness? I can't go into the details of that, just let's go to the slide, which is, actually there are other issues which are also important that we need to bear in mind. One is the special nature of the needs of people with long-term care needs. And indeed, when you look at, for example, what NICE, going back to the English example in healthcare allocation, certain users get special treatment. People who have got, for example, are very close to death, the willingness to pay per quality can go up to 100,000, for example. Yeah, or people who are for whom there's nothing else that can be done. They also get treated separately, differently. So, we need to consider the extent to which the needs of people with long-term care needs might warrant a slightly different willingness to pay. But there's also, and more importantly, I think, there's equity considerations. The establishment, for example, of social insurance models in Germany, in France, in Japan, although it's not a European country, were based on this idea of the risk, of social risk, the importance of, just protecting people against the lack of luck of developing long-term care need. And therefore, those considerations need to be reflected also in terms of judgments about what governments need to do in terms of funding. I'm getting the evil eye here on the right, so I'm going to just say a couple of things more. One is that obviously, there's a big movement towards empowering people, giving choice to people. Well, that means that people are going to decide what to do with the money that you might give them in order to cover their needs. And as a result, you might not end up with what is first assessed as a cost-effective solution for long-term care. So there are issues about the way in which the long-term care system is framed, which limit the applicability of this sort of approach, basically social investment approach to decision-making in terms of funding from the state. I'm going to leave it there. Thank you very much.
Thank you very much. I know you skimmed over a lot of detail there. So now, Plassen's going to take us forward, but can we have panelists coming up to the stage, people who are invited to comment while Plassen prepares getting the slides ready?
Well, I don't know.
Have we got room?
No, I don't think there's room.
No.
So,
do you want to vacate?
You stay.
We'll all be talking about long-term care, but there's a short-term care issue that I'd like to raise. That I have to be excused because my flight is going to be leaving, and I might have to leave the panel. I can assure you I won't be leaving in a half. I won't be leaving because I'll be disagreeing with everyone. But it's these short-term care issues. So. My brief is to talk about the policy lessons from Sprint. And if you have the next slide, please. At the heart of long-term care is a paradox, is that we know that demand will be growing very fast, supply will be growing less, might even be shrinking. And we also know that there are quite a lot of difficulties of handling it, because we have, on the one hand, we have the interface with healthcare. On the other hand, we have the interface with the family. And despite this, there's very little discussion in many places about long-term care. It's as if we, society or decision makers, think that the problems have been solved. And the problem, the really issue about long-term care is the governance issues, that it seems to be very easy to dodge the questions rather than answer them. So, if you have the next slide, please. So everybody talks about how heterogeneous long-term care is. So at first glance, this presupposes that it's very hard to come up with any kind of general recommendation. So despite this, we were quite surprised to find 6 surprisingly firm policy guidelines. Now the point is, these guidelines come up from applying a social investment as a unifying narrative. This unifying narrative manages to bring 3 things together: theory, practice, and measurement. So it assigns places to all these three things and allows the discussion to move forward and allows situations which are thought to fall in different boxes to actually be considered together. And it allows, for example, certain countries with developed long-term care systems to actually look in other countries which do not develop social care, long-term care systems and actually find useful things to take up. Now, just to look forward, I mean, because we're in Parliament, and long-term care at the moment, it seems to me, is at a similar stage of development than the discussion of social inclusion and poverty was in the mid-90s. At that time, the matters were considered too heterogeneous, too different. We shouldn't be talking, but there was a confluence of people theory and measurement, and also, quite importantly, there was political will at some stage. And the open method of coordination in those countries which were already dealing with poverty was no big deal, but in other countries such as my own in Greece, incidentally, I'm Platontinius, I forgot to introduce myself. I thought you all knew me, I'm very famous, but there we are. I come from Greece, despite my accent. So, and Greece is a sort of country that we all talked about poverty, but did very little about it because it wasn't measured. And suddenly somebody came along and offered some measurement which came out of Brussels regularly, and then the politicians and decision makers were actually made to face the problems. I think we're in a similar situation now in long-term care. So, we came with 5 policy guidelines. The first one, of course, is that social investment has value to add. The important thing is it has value to add, not possibly in those countries which are least developed. In a country which already has a well-developed planning system, then implementing social investment guidelines might be simply a decision taken at the high level. But in countries which are very decentralized, then social investment can actually take you a long way. The second is that you need to build a strong evidence base. What I mentioned is that you need indicators. These indicators have to be indicators of outcomes, not processes, not how much you spend, but what is the ultimate effect that you have on spending, and that effect includes the welfare and things which are not easily measured, not only of those receiving care, but quite crucially on those supplying care, the carers. And the evidence base includes production of data, but also includes the ability to analyze the data, which is the issues which were mentioned repeatedly about how do you interpret evidence, how do you measure non-monetary welfare issues. Next. And you need a legal and regulatory framework within member states. The key issue there is flexibility. In order to apply social investment, you have to have the leeway to be able to take decisions. If your hands are tied, then social investment can't give you very much. So flexibility. But we're at an important juncture, and it was mentioned repeatedly, in the European Union, is actually able to take the lead and to take the lead so that member states can go forward and apply social investment. The European Pillar of Social Rights was mentioned, and that can be a lever which can get member states moving in the direction of social investment and taking long-term care seriously. I mean, this is what the ultimate thing. So it's not that we just like talking about social investment. The point is that social investment is a tool which gets us to a destination that we think is worthwhile. The fourth is engaging with stakeholders. Engaging with stakeholders is important because they can have different viewpoints, but it's also important for another reason, is that it can provide gaps in our knowledge. the people who actually work on long-term care, can actually give us leads that, things that researchers might find very hard to measure, and decisions that that people a long way away can find difficult. People who have hands-on experience might be able to deal, because they have to deal with them on a day-to-day basis. The fifth issue is building a dedicated social investment infrastructure. That could include, for example, innovative mechanism, innovative investment we mentioned. In Sprint, we spent quite a lot of time looking at the case of social enterprises in Italy, for example, in a country which is where long-term care as a public concern is not very developed. Civil society was able to take the lead and come up with some innovative solutions. Social impact bonds in the UK are one way of forging a partnership between the public and private sectors. And the sixth is actually operationalizing social investment. Social investment is a great thing for talking, and academics love it, of course, because it brings us, second-year economic social cost benefit analysis. Oh yes, I remember that. Great. I can actually think of something to say. That is very easy. But the point about social investment is it must be operationalized. It must be shown to have use at the coalface, as it were. I mean, the people who are dealing with the problems have to be given social investment pools to play with. And we did produce such a tool. It's there to be used, and it's there mainly to be improved. Because that tool combines information from measurement and knowledge, and allows people also to exercise their judgment in producing both micro and macro points. So, and the final thing, just some final thoughts, that the baby boom generation that's coming into retirement and will, in the next 10 or 20 years, start needing long-term care, were used to operating in the realm of production. That essentially what you were, happiness could be bought, essentially. Now, long-term care brings you into a different world. Even if you have the money, it's not enough. You have you're in the realm of solidarity. And the point is that this is happening at the time when the general environment is increasingly monetized and is much more fiscally aware. So how to counterbalance this? We think that social investment has a role to play.
Thank you. Yes, we got the message. I think we got that message. Thank you very much, Platon. Thank you very much for introducing that. And with really serious apologies, we just have time for some final comments from Stacey. Do you want to kick off since you're? Yeah.
A pleasure. Good afternoon, everyone. So my name is Stacey Gamenos. I'm the director of a European network called Eurocarers, and we represent informal carers at European level. So I have many things I could say. I'll try to be short and get to the point. Well, from our perspective, you won't be surprised to hear that supporting informal carers is social investment. For two main reasons. Social investment is supposed to bring both economic and social returns, based on what we heard again this morning, earlier today, from the Commission. The cost and the contribution of carers in Europe is huge. 80% of care provided by carers in Europe today. The evaluated cost between 50 and 90% of formal long-term care budgets. And based on the Aging Report 2018, so DG ECFIN, if we were to try and replace informal care by formal care, the share of GDP devoted to long-term care would more than double by 2070. So in terms of the economic argument, there's no way around informal carers. I mean, let's face it. In terms of the social return on investment, we also know that when they're not properly supported, informal carers face a lot of issues in terms of social inclusion, access to the labor market, health issues, mental health, loneliness, depression. The prevalence of mental health issues among non-working carers is 20% higher than among non-carers. So there again, supporting carers makes sense in terms of the social return. So what do we need? A lot of things are going on. Again, we heard that earlier today, and in fairness, a lot of member states and EU regions are slowly trying to address the issue, but it's still a very patchy policy environment. So the pillar of social rights, we believe, brings a lot of hope, and the point made by Platon earlier about the comparison with the discussion around poverty and social exclusion in the mid-90s, and how the EU initiative put a bit of pressure on member states is very interesting. Because I think indeed what we see now, thanks to the pillar, is that it was not mentioned by the Commission, and they left, so I'll take the liberty of mentioning it. We know, for example, the group of ministries, all member states working with the Commission, are now actively discussing the development of comparable indicators in the field of long-term care, for example, which is a major step forward in a recognition that something needs to be done at European level as well. So what we're trying to achieve now is to develop the policy environment, what we call the carer-friendly policy environment required to address the numerous needs of carers. So by including and developing a good definition in the national regional legislation of what a carer actually is, by making sure identification mechanisms are put in place, by ensuring there are assessment mechanisms as well of the needs of carers, and by providing carers with very basic things such as access to information, training, recognition of skills, respite care, and so on. So this is a scoop for you. At the end of November, we'll be launching in the European Parliament a proposal for an EU strategy on carers, which in many ways really builds on existing initiatives by the Commission, by other authorities, to try and bring a comprehensive and multidimensional picture of what it is that needs to be put in place at national, regional level to actually support carers actively. I'll close on that note. Thank you.
Thank you very much, and thanks for the scoop. Piotr, do you want to go next?
I think that majority of us has our flights in 2 or 3 hours, so I will speak very briefly. So, I think that the biggest problem in the future is related with population aging, but of course with the double aging. The big increase in number of the people being in the 80s, 90s, being centenarians, is very important. Why? Because I think that it will change our meaning of social investment in long-term care. Why? Because I think that it will change our meaning of social and economic return. Think about the typical age of the informal carers. It means if you have a nonagenarian in your family, it means that the carers are in the 60s or maybe in the 70s. It means that we couldn't speak about some results defined in terms of employment. So it means that it will change our methodological approach to assess the social and economic return on social investment. At the same time, please think about the other aspect of the economic and social return, because I think that investment in, for example, in supporting informal carers, we said about it, family carers, when we speak about people being in their 70s, how to say it, it's much less effective, I think, in economic terms, of course. And it's a first issue. I think the second issue I should speak about is related to fact that we try to forget about the so-called cultural lag.
It means we could find many very good, very effective in economic terms solutions. But I'm not convicted if, to be honest, if people are always happy with the solutions. Please remember that human needs should be not only defined in physical dimension, but also in psychological dimension. And I'm not sure if many the so-called good practices in area of LTC is a very good practice. Thinking about the cultural lack and how to say traditions, expectations, preferences of the people. And I think that's all. But frankly speaking, as as a man who's involved in helping decision makers at regional level, national level, I'm still thinking about operationalization of your approach. It means operationalization of social investment as especially social return methodology, because it's very good for us academicians to speak about sophisticated terms, sophisticated measures, but of course how to explain to decision makers what is a good solution and what is better solution. And I think it's very good difference. Good solution and the better one.
Okay, thank you very much. Thank you very much. Some very useful points, Borja.
Hello. So I will speak on behalf of Age Platform Europe, which is the European network of organizations of older people. So organizations advocating for the rights and the well-being of older persons in Europe. So as you can imagine, long-term care is a central topic we deal with in our work, in our advocacy work. So we are quite happy that this project took place and that we have now more evidence showing to what extent long-term care can also be social investment. The challenges in long-term care were mentioned a couple of times already, in terms of access, in terms of quality, affordability of services. Something that was not mentioned is that this is also, and well, that's our key message as a civil society organization, this is also a human rights challenge. A couple of years ago, there was some research done by the European Network of National Human Rights Institutions that showed that in long-term care services, there is a lack of awareness of how to respect the dignity and the human rights of those needing care. And we also know that older people with insufficient access to quality care services, they suffer situations that qualify as breaches of human dignity. So it is important for us to put that at the core of our discussions when it comes to long-term care. So certainly we think that the social investment approach can help shift the care systems from very, let's say, precarious models of care delivery where, well, long-term care has been underfunded, has been, let's say, put in the hands of families organizing themselves to deliver care to older relatives, care services with a very paternalistic approach regarding the way they were treating older persons without really taking into account the personal, individual preferences of people needing care, from very medical approaches to care, ignoring completely the need for socialization, for inclusion in the community of people in need of care. So that's the old model that is still very much, let's say, the one that exists across Europe in many services. So a shift from that vision to a vision where, care is delivered in a person-centered way, and the needs and the preferences of the individual are at the core of the way the service is delivered. And also services that put much more the stress on rehabilitation, on prevention, and that really apply the principles of social investment. So we think that the social investment approach was and is a good approach in operating that shift. We are very happy that the European Commission was proposing this social investment package in 2013, and Bart van Herke kind of certified the death of the social investment package. Not that you wanted it, but I mean, like, but well, we were all kind of fearing that the European Commission wouldn't be really continuing with this approach, and that has been confirmed since the Juncker Commission took over. From the point of view of our work at European level, this is a bit well, let's say, difficult because we are building our expertise, we are building our arguments around an approach, thinking this is the new thing that will be imposing itself, this social investment approach. And well, some years later, we find ourselves that the European Commission is actually abandoning this approach somehow, or not really insisting on it as much as we would wish. We believe that the European Pillar of Social Rights can be important, and this is certainly an opportunity we want to seize. And well, a couple of hints were shared by the European Commission today on these indicators shared with the Social Protection Committee, etc. But we would like the European Commission to maybe get back to the cupboard, open it, and again take out from it the social investment package and see whether that can still again be useful to advance social policy at European level. And maybe I can end by pointing to a very interesting comment and very interesting part of the presentation of José Luis about society's willingness to pay. So that's central to these debates, of course. If we want care to be cheap, or if we are not willing to pay a lot for care, well, access will remain very low, quality will remain bad, and we will all need these services at some point in our lives, so we all have a personal interest in challenging this situation. And I would say that our role as NGO is precisely to kind of encourage society to be willing to pay more for care services. And we are currently having a campaign on ageism, which is this form of discrimination based on age that affects everyone at all stages of life, but we know that this is very especially the case in older age. And one of our aims is precisely to help society realize that we are all aging and that at some point in our lives we will have some care needs, and that doesn't mean that our dignity and our human rights should be at stake.
Excellent. Thank you. Okay, that's a very good note to think we need to end on. Very grateful for all the speakers and the panelists who've sacrificed, I'm sure, many thoughts that they could have offered because of time constraints. Oh, we have a question, a point. Bart.
I have a question, a point, yes. Alan, thank you. No, because, Borja, I'm not sure that I certified the death of the social investment package. So I would just like to nuance that a little bit. So I tried to explain that the SIP was launched with lots of balloons and flags and firework in 2000, what was it, 13. Right? It didn't take off as a social policy framework, as Laszlo Andor had understood. It was then forgotten for, I would say, 5-6 years. Not forgotten, but put under the carpet by the new commission, because when a new politician comes in power, of course, he has to forget about what the predecessors did. And now it's being used again as not as a policy framework, but as a concept, a little bit as a supportive tool in the context of the European Pillar of Social Rights, but also the ESF plus the multi-annual financial framework. So it's not entirely dead, it just went under siege in a way. Just to nuance that, now I'm not sure whether what you say that you hope that the Commission will revisit the SIP now is a good idea, if I understood you correctly, because, I mean, I think the SIP has been completely absorbed into the European Pillar of Social Rights. Well, not completely, but partially absorbed into the pillar. I think it would be a very bad idea that next to the pillar, we have another social policy framework that is in competition, namely the SIP or whatever else. So I think we, or you as stakeholders, you have more interest in hanging on to the pillar, making sure that it survives this commission, because there is absolutely no guarantee, of course, that the formal proclamation will tilt us, will bring us beyond this commission. We don't know that. So I would really suggest to stakeholders hang on to the pillar and make sure that within this new policy framework, social investment is boosted. But we can discuss over lunch or beer or whatever.
Yeah, I think that's a discussion that will run, isn't it, for quite some time. But thank you again for your second talk. That's very welcome. I think we're going to draw things to a close because I think we need to leave the room. Do we not? Yeah. Are there any more quick points or comments that people want to make before? continuing the debate.
Yeah, no, but maybe a very short response. No, I didn't want to be that strong in saying that you certified the death, of course not. I'm not saying that strategically that's the good thing to do, to ask for the comeback of the social investment package, but I just think that the work that was done and the actions that the European Commission was planning in that field, that, well, somehow we need to see kind of how that fits into implementing and developing the European pillar of social rights, because for us that's not really that clear. So clearly, strategically, now the priority certainly is making sure that the pillar survives and that the next Commission is keeping it, of course. Yeah.
Okay, thank you very much. Please check out the Sprint website to follow up on any of the material that's been offered today. And I'd like to thank all the panelists, all the speakers for battling against time constraints, and all the participants. I think it's been really an interesting and fruitful discussion. I hope you get home okay. Transport isn't in a good shape at the moment, so good luck. And thank you very much indeed for coming. Thank you.